Well, vaping products were once touted as a safer alternative to smoking, and thus sales of these products skyrocketed. Now, as more and more lung illnesses and even deaths are being reported, vaping is considered just as big a public health threat as smoking. So Brad Lucas is the interim chief medical officer at Buckeye Health Plan. Here is some insight into how they're dealing with the issue. And Brad, we were just discussing it's a big day for Ohio because they are kind of reacting to this, right?
Yes, thankfully. Starting tomorrow, you now will need to be age 21 or above to purchase cigarettes, e-cigarettes, and vaping products.
I imagine in the position you're in, that's good news to hear.
Yeah, this has been, I think, a surprise to us in healthcare, how quickly this has become this serious. We've worked so hard for so many years to really lower the rate of smoking, and we've seen that be successful, and now this has just exploded.
And the thing is, vaping, we were just discussing, this really was kind of a targeted towards younger people kind of product. It came to that, I guess. It didn't maybe start as that, but it turned into that. I'm
not sure what the intention was, but it was a no-brainer that something that could be kind of hidden and maybe has a sense that it's more cool than smoking, and flavors for vaping.
Right.
It's 18 to 21-year-olds, 21% of the deaths from this has been in that age group.
It just appealed to that market.
That's the word, yeah.
Deaths and illnesses. We've been hearing about plenty. What is the situation here in Ohio?
In Ohio, there's been 28 deaths that have been tied to the vaping. Okay, there's 30 more that are being investigated across the country. As of last week, there was 1,299 severe lung illnesses where people who were previously healthy, and these were all tied to vaping, now with severe lung illnesses.
And to that end, as you mentioned, these were previously healthy people. What is then causing it? Do they know how this is kind of interacting?
Epidemiologists, we're still working on understanding this.
Yeah.
There's something different. The people have unfortunately died when pathologists have taken a closer look and looked at the lungs. They've described it as if there was a chemical spill. So it's different and dangerous and unpredictable.
Yeah, and I think that sums it up, right? I mean, the fact that it's unpredictable. So Buckeye Health, you guys, I mean, obviously you're on the forefront of trying to educate people about this and getting it out there. So what do you want people to know? If they've got a teenager, even if they've got somebody in their family that's...
We want parents to have conversations with their children. We're trying to understand which of our members are exposed to this or don't quite have the full understanding. We're talking with them, making sure that you see your doctor, talk to your doctor. We provide all the coverage necessary for smoking cessation, or just sitting down and understanding what would be the steps to kind of get unwound from this dangerous path.
And you mentioned smoking cessation. So is this the same kind of path for trying to get someone off of it?
Yeah, it is. It is. I think there's probably more understanding and education. I think most people are in agreement that smoking a cigarette it takes you down a wrong course over a period of time. It just affects your body in so many ways, and we need to associate the damage from the cigarettes. It's very similar here, but even kind of more worse things that can happen right away.
I was going to say, this seems to be something that instead of saying, you know, in 10 years after smoking for 10 years, I mean, these people are not smoking or vaping for a long time before these illnesses are happening.
You need a plan to kind of stop now.
You do, before you're one of those statistics. And we mentioned there's a lot of kind of, I don't know if black market or things out there, right, that people are exposed to in the vaping industry.
I think there's probably just non-standardized counterfeit products, and we don't know enough to know which products are safe or not. That's the thing, but there might be some difference with the oils that go into these to make it all work. Heats up an oil vaporizes, and there's some oils in there that are causing these chemical problems.
Do you guys see too, as you're on the forefront, people that maybe start vaping, I mean, that can lead them to smoking regular cigarettes, maybe doing another, I mean, because it is an addictive
it's an addiction,
behavior, right?
It's an addiction, and if I think we're going to see some of these products outlawed. There's universities outlawing them. There's states that are outlawing them for the flavored ones. So we're going to see that, and that's good. And if then they might be left to wanting to smoke cigarettes, which they probably never intended.
Right.
So yeah, the problem's going to continue, and just best to start to really be aware of it as soon as possible.
Absolutely. Get help as soon as possible, as we mentioned, because this is not something that's taking a long time to really impact you in a very dangerous way. So if, of course, you need help quitting, you can obviously reach out and get a referral to an addiction specialist. I know you guys do that a lot. So all the information up there on the screen to contact them. So thank you, Brad.
Thank you.